Welcome to the Foresight Health Roundup podcast, Foresight Health's podcast series for healthcare revolutionaries. Outcomes matter, customers count, and value rules. Hello again, everyone. This is Dave Burda, news editor at Foresight Health. It is Thursday, September 4th. We're still not talking about the Epstein files on today's show, or occupying U.S. cities with a deputized private army controlled by the president, which, by the way, a federal judge said is illegal. No kidding. But we are talking about a private army controlled by the president taking over our public health system under the direction of RFK Jr. as HHS Secretary. How should the private healthcare sector react? That's what we're going to talk about on today's show with Dave Johnson, founder and CEO of Foresight Health, and Julie Murchinson, partner at Transformation Capital. Hi, Dave. Hi, Julie. How you two doing this morning? Dave?
All things considered, doing fine, enjoying the weather, a little nip in the air, cool mornings and evenings, warm during the day. It's a reason September is my favorite month of the year.
Yeah. You like a song too, right? Earth, Wind, and Fire? Do you remember?
Yeah,
right?
Yeah. Well, that one comes on my birthday. Do you remember the 21st day of September? Who gets a song like that for their birthday? Maybe the greatest dance song of all time, right?
Yeah, absolutely. Thanks, Dave. Julie, how are you?
I am well. I have to say, like last week felt like summer, and this week feels like serious business. So I don't know what it is about Labor Day, but it just kind of turns a crank.
Yeah. I think we woke up here to 49 degrees, so that's quite a change. Yeah. All right. Now, before we talk about the CDC, let's talk about the NFL. As you know, the season kicks off tonight with the Eagles hosting the Cowboys. So it's time to get your Super Bowl predictions on the record. So, Dave, who do you think is going to win the Super Bowl this season?
Well, despite the fact they've never done it before and lost 4 times in the big game, it's the Vikings, of course. Who needs an experienced quarterback to win the Super Bowl? And by the way, Dave, I know you're going to say the Packers, right? Because you bleed green and gold. But I just want to remind you, the Vikings traded away their future for Herschel Walker ever so many years ago. And that sent the Cowboys to the several Super Bowls and the Vikings into ignominy. Could happen to the Packers, too. In fact, I'm hoping it does.
That answer runs deep, Dave, and I really appreciate it. Julie, how about you? Are your Dolphins going to do it this year and host the Lombardi Trophy in February?
Oh, my God. Well, the Dolphins, in the last year just gave up Durham Smythe to your Chicago Bears. So I don't give the Dolphins a lot of hope. But I will just channel my son and say it's going to be the Niners, obviously.
Yeah. I think he's been a fan of the Niners for a long time, right?
Yeah.
Well, Dave, you're right. It's Packers for me or bust. And I hope that sounded very nasal because it should. I can't predict anyone else or they won't let me back into Wisconsin to fish. So
would that be the worst thing? Really? I mean,
well, for most people, yes, it would. It'd be okay not to go there for any reason, but I'll still go there on occasion. Okay, let's pick up where we left off last week and talk about what happened at the CDC. By now, you know that RFK Jr. and then the White House fired the CDC director. Then 3 high-ranking veteran CDC leaders resigned in protest. As the 3 left the CDC building, they were applauded by the agency's staff, who handed them going-away flower bouquets. There's been a lot written since what Dave called the Wednesday night massacre, but the one thing that stuck out to me, and the comment that we're going to react to on today's show, was by the well-known medical ethicist Arthur Caplan. Caplan said, and I quote, "The CDC is now not a functional agency. At this point, professional societies, state health departments, industry, academic groups, self-organized expert groups, and international groups must do their best to fill the hole left by the destruction launched by Kennedy and his stooges." Close quote. That's a very powerful statement. Dave, what's your reaction to what Caplan said? Who's in the best position to fill the void left by a non-functioning CDC? And what are the pros and cons of private sector organizations playing a bigger role in public health?
Yeah. Well, first, what's going on at the CDC. I'm reminded of the famous lines from William Butler Yeats' poem, The Second Coming. Things fall apart, the center will not hold, the best lack all conviction, and the worst are filled with passionate intensity. We're in one of those moments right now. In 1992, the Centers for Disease Control expanded their name to become the Centers for Disease Control and Prevention. And initially, I thought that's where RFK's attention was going to be, making America healthy again, evidence-based prevention. I think we collectively were trying to give him the benefit of the doubt, but he's absolutely turned his statements during confirmation and run-up on their head. It seems his real intentions are to be anti-vaccine, to find disproven reasons for why autism occurs in kids. He's just bulldozing evidence-based public health policy practices. I'm now calling this MALS syndrome, M-A-L-S, Make America Less Safe. You heard it here first.
Yeah, that works.
The MALS syndrome. And actually, Julie, I'm reminded of your highlighting Carolyn Kennedy's statement when she argued against his confirmation, saying he was a predator. Well, I think that's turning out to be true. And I think everything that's happening in the CDC is turning into a Chernobyl level type of event where the government ignores science for public relations purposes or some other agenda. I happen to have recently watched the HBO series on Chernobyl, and the book ends with two quotes from the scientist who ultimately committed suicide, but the one who really saved Chernobyl from becoming an even greater disaster at enormous cost to his personal health and reputation and so on. His name was Valery Legazov. And so the first quote at the beginning of the series, "What is the cost of lies? It's not that we'll mistake them for the truth. The real danger is that if we hear enough lies, then we no longer recognize the truth at all." And with all of this talk of anti-vaccine talk and autism and so on, I think big chunks of the population no longer recognize the truth at all. And then at the end, he said, every lie we tell incurs a debt to the truth. Sooner or later, that debt is paid. And that's probably what I'm most afraid of, is we seem to have forgotten how many people died at the outset of COVID and how much uncertainty and panic there was. There was a moment where, as a country, we really could have come together to fight against COVID, but it didn't go in that direction. And now all those hard lessons seem to have been forgotten. But the deaths are going to come. We're going to see more deaths from measles and other childhood diseases. Children will die who shouldn't. And we're less prepared for the next pandemic than we were for the last one. And you know how unprepared we were for that. But Dave, you asked, okay, you got a dysfunctional CDC. What can arise to help or to fight against that? Maintain good public health policies. And it really is starting to feel a little like Star Wars, with the organizing to fight the empire. You had over the course of the last week a West Coast Health Alliance Forum with California, Washington, and Oregon. Way to go, Julie. Yeah. And then a Northeast Public Health Collaboration. It's got 8 states, all the New England states, except New Hampshire, of course. They're going to break free of the administration and its policies, and they're going to execute rational public health policies, recommendations regarding vaccines and other things. I do worry, of course, that the Trump administration will exact their pound of flesh for anybody that dares to go against them. His 3 modes of operating are attack, number 1. 2, never apologize, never admit defeat. And then number 3, always declare victory. RFK is sort of following that playbook. I guess the big question is, at what point does he become enough of a liability that Trump finally kicks him off the team? We seem to be a long way away from that, because Kennedy is so important to Trump's political positioning in the country and ability to win elections, particularly the House elections next year. There's pros and cons. I mean, not having central public health policies equitably distributed across the countries is a real loss. What you can say in a federal system, you do get 50 or 51 state laboratories that can test out different things and see what works and what doesn't, and other states can copy successful states. So maybe a hint of a golden lining here is that these new federation-like coalitions, public health coalitions, will discover some things, implement some policies that dramatically improve public health in those states relative to others, and over time will replicate that across the country in the way federal systems typically do, maybe. But I think the bigger loss is we've taken perhaps the world's most effective public health agency and gutted it, and it's going to take a very long time to rebuild its capabilities.
Yeah, I just made a list of the states surrounding Illinois. Let me know if I missed one. Wisconsin, Iowa, Indiana, Missouri, and Kentucky. Right? We're screwed.
Yeah. Well, the Midwest Alliance will be Minnesota, Illinois, and maybe Michigan.
Yeah. Cross your fingers.
Come on out. Yeah. It's nice out here.
A nice time to visit and stay. Thanks, Dave. Julie, any questions for Dave?
Well, Dave, these, I don't know, what, 8 or 10 former CDC directors who stood up and made their statement. I mean, it was bold and strong, and I was really...
And ignored. Yeah, exactly.
Ignored.
But, yeah.
Right. So this gets to my question. Let's just try to be productive for like a second. So you probably saw that Senator Bill Cassidy, who's a physician and was one of the deciding votes for RFK's confirmation, has now, he's back on his heels. And he's saying that the ACIP should postpone its next meeting until the CDC leadership situation gets untangled. And he thinks that any recommendations that might come out of that group should be rejected as lacking legitimacy. So he's obviously having second thoughts. When you look at something like this, what other types of government leaders would you like to see come forward in a similar way that could potentially turn up the heat in a more serious way? Bipartisan, American first, health focused, all the right things.
Yeah. Well, you're right to focus on the Republican Senate, because I think that's really the only potential break in the system. I mean, Bernie Sanders had an op-ed in the New York Times declaring that RFK should resign for all the reasons we've been talking about. I wish I were a little more confident about Cassidy based on those statements that you mentioned. He was the one who got Kennedy to admit during the confirmation hearings that Kennedy would follow real science as HHS secretary. But in all of the fallout this week, Cassidy also said, we're in a process, so let's go through the process. So he was actually urging caution and putting the brakes on even while he was saying some of these other things. But there have been some others in the Senate. Tillis from North Carolina, who's not running for re-election, so he can say what he wants. He got up and said he wants to understand why the words that Kennedy uttered in the confirmation, like he was going to follow real science, haven't been matched in deeds. John Thune said there'd be hard questions. He's the Senate Majority Leader, about Susan Menarez's firing. John Kennedy, the other Louisiana senator, said he wants the chaos to stop. John Cornyn's kind of weighed in on this as well, from John Cornyn from Texas. If the Republican Senate finally gets up its courage and moral decency, it can start to straighten things out. There's some hints it might, but been really no evidence up to this point that when push comes to shove, they'll take on the president. So I wish I were more optimistic, but if it's going to come from anywhere, that's where it has to come from.
Yeah, thanks, Dave. Julie, what's your reaction to what Kaplan said? Who's in the best position to replace the CDC in terms of providing fact-based public health guidance? And what's the good news, bad news of the private sector playing a bigger role in public health?
Well, so much of this question seems to be mired in laws that prevent or control other various parties from calling the shots. But it seems like the West Coast Alliance doesn't seem to care about that. And others who are coming out of the woodwork, proposing that they'll do what they need to do. So I'm thrilled about the West Coast Alliance, by the way. Very excited.
Yeah.
Going to figure out who I can talk to throw my hat in the ring. But so I guess my question is, if this is some sort of effort to reduce centralization like we're seeing in so many other places, I don't necessarily think that that's where RFK is coming from, but obviously that's where the administration is coming from in a lot of areas. To give power back to the states. Are the states ready to do any of this? Is there sufficient funding? Is decentralization of science that affects Americans, whether they live in Chicago or California or Mississippi or Florida or wherever, logical? I don't think so. So I went back just to try to figure out, like, okay, what is the history of all this? And like way back in the day, and Dave, I'm sure you've read all of this in a million books, but before the 20th century, public health was almost entirely a state and local responsibility, and they ran quarantine stations and sanitation programs and, get this, vaccination campaigns before the 20th century. Local health boards handled outbreaks. So much of what was happening was local, which makes sense, right? But by the mid 20th century, urbanization, industrialization, called for much stronger disease surveillance, and the CDC was born. We had to figure out how to deal with all that was happening, all the outbreaks. So fast forward, the states are now basically frontline implementers of public health laws and what science ends up looking like at a local level, programs, et cetera. And the feds have led the funding research and surveillance and setting standards and emergency resources. So, while RFK is coming at this from the science perspective and trying to, get around or kill that part of what the feds do, there's so much apparatus around that is going to break down very quickly and leave the country and the states with nothing to really implement, right? So I could